Hello all, and thank you for joining us. On behalf of Dr. Bitinge, Ajwang, Chitsunge, and Carrillo, it is our privilege to welcome you to International Phytomedicine and Medical Cannabis Institute flagship program. We are excited to introduce the course From Farm to Bedside, Phytomedicine and Medical Cannabis. This program is designed to advance knowledge and clinical practice through patient-centered care, innovative outreach, cutting-edge research, and transformative education. The International Phytomedicine Institute is a pioneering initiative of the Global Oncology University, established through the visionary effort of Global Health Catalyst. As a forward-thinking institution, we are committed to shaping the future of integrative medicine on a global scale. Today, we are honored to introduce Professor Will Ngwa, founding director of the Global Health Catalyst, alongside co-director, Prof. Stephen Avery, and Dr. Seifel, and Prof. Seifel, sorry. These are renowned leaders in health innovation. Prof. will share the inspiring story behind the Institute of Phytomedicine creation and bold vision driving its worldwide impact. Prof. Will, the floor is yours.
All right. Thank you so much, Dr. Billy. It's wonderful to be participating in this pioneering international phytomedicine course today. And I would like to just start, like Dr. Billy has said, to provide a little bit of background on the importance of phytomedicine, especially in global health context. So, as you may know, about 80%, and this is study from the World Health Organization, about 80% of the populations globally in Africa and extended globally use some form of phytomedicine or traditional medicine in their healthcare. So that really means it's a healthcare system that's employed by billions of people around the world. And unfortunately, I would say it's under utilized. When we talk about global health, typically we talk about modern medicine, we talk about all different things, but we do not engage in this particular healthcare system. And that's something that every community has access to, or billions of people have access to. And so we think through this course, we can really empower people, if you are participating in this course, with the knowledge that you can also get the scientific evidence, an education background, so that you can be advocates and leaders in your own communities around phytomedicine. So just some background, like Dr. Billy mentioned, we've been organizing the Global Health Catalyst Summits at Harvard and other institutions since 2015. And then in 2019, we really thought you don't go to any global health conference and hear about phytomedicine. So, prior to that, there have been a number of sessions on phytomedicine and medical cannabis and how you can empower people with knowledge on the evidence, on the science, so they can be able to use that. And so in 2019, we launched the International Phytomedicine Institute at Harvard Global Health Catalyst Summit. So you can see some of the people on this picture who were there at the beginning, including Dr. Briley with a beautiful smile right in the center, and the Minister of Industry and Farm and Agriculture from Jamaica. So government leaders, industry leaders, academic institutions, first ladies from different, from Nigeria, and ambassador of Mozambique, and a number of leaders, Calvin Johnson, the Hall of Famer, of the football in the United States, and many other leading scientists, and so this was really, looking at the future. And then unfortunately, 2019, COVID-19 disrupted a lot of the momentum that was built on this. And so now we are post-COVID, and, really think that it's time to really launch this forward for again. So thank you all for joining. I would say that I am from Wakanda. I call myself from Wakanda, which is supposed to be in East Africa, but I think, you can pick what geographic location you want it to be. And, if you've watched the movie The Black Panther, you may hear about, the superpower of the Black Panther actually comes from this herb, from this plant in Wakanda. And I think, and Wakanda actually happens to be this futuristic city where you can go and have your health care. The technology is so advanced, everybody can have their health care there. And so I kind of like this picture to kind of capturing, what the power of phytomedicine. What if you could just empower communities around the world with the knowledge to use the need in their to use phytomedicines? And actually, I got motivated by this because in my own community, where I was born in Africa, we actually learned about this. In 2019 at Harvard, we presented these results on the blood from plants. It's a plant that we discovered that can actually provide more hemoglobin than human beings can. And this is going to be a lecture that, we will have dedicated as part of this series in upcoming lectures. And really kind of showing the science, how you can live from farm, from just cultivating plants like this, and then moving that to through the lab, where you do the research, and then to clinical trials where you do that in patients to the bedside. I think what's really going to be important is how you also take this to commercialization and sustainability into the society. And that's something that Dr. Berlin is a great leader in that, in being able to, launch that kind of initiatives in Africa. But this is just an example, and there are millions of other medicinal plants, including medical cannabis, which we're going to talk about throughout this course. But I would like to hand over first to Dr. Sandra Carrillo, who is a professor in Colombia and who has been a really great champion in joining this International Phytomedicine Institute initiative. And I would just plug out that, this is just the beginning. This year in September, we're actually gonna relaunch, reignite this initiative in a way that as a platform at the Harvard Summit, September 19. But let me hand over to Dr. Sandra first, and then Dr. Berlin after for her remarks. Thank you.
Thank you so much, Dr. Will. This is such a pleasure for me to be here today launching this amazing program. We've been working for a few years. This was at the beginning a dream, and how to educate to the world into superior medicine. And I have the honor to be part of the International Phytomedicines Institute since I think 2020, 2021, and being like leading in Latin America with cannabinoid medicine. I feel very happy that today, after working for all these years with the International Phytomedicines Institute, we have this amazing educational program from the farm to the bedside that is so important, because we want our patients, as a physicians, we want our patients to have the best medicines, and of course the phytomedicines can provide many alternatives for physicians and for patients. As you mentioned, Dr. Will, there's been a lot of research done, and we are very optimistic that more research is going to come out of this. But in order to keep doing research, we need the communities, the professionals, the healthcare practitioners to learn how is the medical cannabis works. And this is what is this certification that we're launching today is so important, because it's a very comprehensive program where we will have faculties and professors from all over the world doing this amazing collaboration into teaching the most important important subjects about how the endocannabinoid system works, how the cannabis works in the clinical practice, different types of processes that the cannabis plants have to go through in order to become a medicine. So also the research part that is so important and allows us as physicians to access this research and apply it into the treatment for our patients. So this is a fascinating educational program. And the important thing is all these collaborations that we have from physicians and healthcare professionals from all over the world, all reunited in this wonderful educational platform. It will be translated in different languages, so we will be able to grant access to the people from different corners of the world to access to education. I have been involved in education for around 10 years. I've been teaching in different universities in Latin America, and it's for me a pleasure to see this amazing group of professors gathered in this educational platform. I really invite everybody to subscribe to this educational platform, because you will have a lot of benefits into learning how cannabis works, how the endocannabinoid system works, and it's definitely a very important alternative, since education is the key to promote safe access for the patients through prescription, through a reliable source of a product or medication. So I am very happy to be here with Dr. Fleury, with Dr. Billy, with Dr. Berlin, and with Dr. Will, that has been leading all these amazing initiatives, and also very happy to be collaborating and representing Latin America. And I am sure that all the students that they're going to see this program, they're going to obtain tremendous benefits. So I want to now give the next words to Dr. Berlin, which has been also a key part of the development of this amazing educational platform. I am very happy to be professoring here and to be helping to put together this great program.
Hello, everybody. Thank you so much for this opportunity. It's such a great honor and pleasure, and I welcome all the attendees, and thank you for coming on board to walk this journey with us as we explore the plethora of these phytomedicines, and in particular medicinal cannabis. And I'm actually talking from South Africa, and it's actually quite an amazing thing to see the worlds coming together with our colleagues there in the US. And I just want to say thank you so much to the Global Health Catalyst team, which we are part of, for putting this wonderful initiative together. And it's amazing to see a lot of people coming on board to join, and this is a wonderful thing. I just want to say, from the inception of Global Health Catalyst, I was actually part of the founding teams, and I'm so happy to see the journey we've grown year on year, and having more people on board. And it is an amazing initiative, which I think the whole continent and the globe at large needs to understand the use of phytomedicines. As you all know, that they are used every day, every second as we speak right now, someone is actually using these phytomedicines. But do we really understand what it's all about? So as we go to unpack with our academias, our scientists, and all these exciting speakers on board, I look forward to the deliberations, and also by the time the course ends, that everybody has something to take away with them. And this is a wonderful journey, a wonderful initiative, and there is just so much to learn about phytomedicines and medicinal cannabis. For those who are not so aware of these big words, the phytomedicines is the plant, is the herbs that we use every day is actually herbs from plants. So that is what phytomedicine is all about, because I'm mindful of everybody on the platform that we've got like from 16-year-olds I saw that have joined as well, and going up to as far as 80-year-olds that have actually come to join this initiative. And I look forward to the deliberations. And once again, thank you so much for joining this wonderful platform. So I welcome all of you, the attendees, to this initiative, Walk the Journey Together from Farm to Bedside. Thank you. Thank you.
Hello, everyone. My name is Dr. Flori Augustine Sole-Bitege. So I'm a teaching professor at the Northeastern University. So I've also joined the International Phytomedicine Institute, where I'm collaborating with Dr. Sandra, Dr. Brilin, Dr. Belinga, and Professor Wilfringwa. So we look forward to provide you a very an excellent educational platform, especially where we know in phytomedicines, there is a need of workforce needs in many countries. And we hope through this program that people will enable to learn a lot and kind of push the collaboration as the one that we are currently establishing, for example, with the Phytomedicine Institute in Gabon and Burkina Faso and many other countries. So welcome to the course, and I hope you're going to have a very good experience throughout this journey. Thank you very much.
Thank you so much for the introduction. And I just want to give, for today, I'll be the one taking you through the journey of understanding what phytomedicine is. Thank you so much, Dr. Flori, for the introduction, Dr. Brilin and Dr. Sandra. Today I'll be taking you through our program for today, From Farm to Bedside, evidence-based phytomedicine for global health. I'm talking from Wakanda. I'm representing Africa, Global Health Catalyst in Africa. And it's a privilege that you have joined us today. Let us take this journey together. By the end of this journey, we want you to understand, to have like a brief understanding on what phytomedicine is. We're gonna take you through the historical recording and drug discovery. We're gonna also educate you on the relation of phytomedicine to citizen science and the relevance of phytomedicine to global health. As you heard from Dr. Braley, phyto just means, it's a Greek word meaning plant. So what does phytomedicine mean? It means just medicine made from plants. If you have used plants to treat any ailment, that is phytomedicine. Also, it encompasses the innovation and methodology of utilizing plants towards prevention and treatment. As you heard from Prof. Will, according to the World Health Organization, 80% of the world population uses herbal medicine as a primary health care. And 25% of modern medicine are derived from herbal medicine, that is plant medicine, phytomedicine. 40% of pharmaceuticals products today draw from nature and the traditional knowledge. And this is projected, the rate of revenue that comes from phytomedicine is projected to increase to $356 billion by the year 2035, which means the knowledge of phytomedicine will increase, is continuing to increase day in, day out. But when we talk about phytomedicine, we have, as human beings, we have different names that can help other people identify us. I can be easily be identified as Bilinga Tendwa today because of the names that were given to me. So we also identify plants by the names, scientific names that are given to them. We have common names that are found with plants like from all over the world. A plant that is found in South Africa may not be called the same name as native people in Brazil. So for us to have a unified naming system, then the scientific world came up with a method where they stipulated that most plants will be named using their genus and species name. You know, we have 5 kingdoms: plant, animal kingdom. We have fungicide kingdom, but we belong to the plant kingdom. Today, I'm interested in the plant kingdom. And in the plant kingdom, you also have the phylum, which is a collective of so many plants. Either is it a flowering plant? Is it a non-flowering plant? Does it have one seed or 2 sides of the seed? Is it a monocotyledon or dicotyledon? That is a class. Which order of related plants does it belong to? Which family does it belong to? Genus and species name are the commonly used names in the plant kingdom. Hence, binomial. Binomial means 2. Nomenclature just means naming. So why do we use binomial nomenclature? We use for unambiguous in the identification. When a plant, as I said, a plant from different countries may have the same plant, but with different names, common names. So for us to have a unified name, then we have the scientific name that can identify this plant wherever place we are in the world. For reproducibility in research, if we have the same plant, we can do the same research in Tanzania, and the same research can be done in the UK, and the results will be similar or close to similar because we are using the same plant. For safety and efficacy, we want to use the correct species of plants, the same species all over the globe. It's very important also in global communication. For me and you, now we can communicate with a common scientific name. Similarly, for legal and regulatory clarity, the same regulatory rules that may apply in the US of a specific plant would have similar rules maybe somewhere in Cameroon, because we are talking about the same species of plant. Understanding the relationships in plants. A plant may belong to the same genus, but may have various species. And various species may have different chemical compounds that are used or that are medicinally important. So because of this, we come with the naming system that can be identified by you and me. Why is the from farm to bedside important? You heard from Prof. Will, who stipulated the importance as he introduced. But also, I just want to emphasize on the importance from farm to bedside, where a plant is based or where, due to the environmental factors, the chemical compounds may not be the same due to climate, due to the altitude, the amount of temperature, the amount of rainfall received, the UV of light may alter the secondary metabolites of the plants. For example, we have Artemisia annua. This is a very important plant in production of malaria drug. It has been used as an anti-malaria compound for first-line treatment of malaria globally in areas that are affected by malaria. At higher altitude, it produces higher artemisinin product, and that is the compound that is very important for malaria treatment. Ginseng, which is a common, everybody knows about ginseng. It's a common adaptogen. It helps the body recuperate easily. In mineral-rich soil, it produces higher genosides level, which are important chemical compound in these plants. Fertilization, agricultural practices like fertilization may alter the chemical compounds or metabolites of plants. For instance, increase in nitrogen may reduce the phenolic compounds of plants. Alkaloids, for instance, the ones that are found in Caranthus roseas, which is a drug that is used to produce vispristine, very common in the medicine world for treatment of cancer. The alkaloid levels will peak at the flowering time. So when you want to do the harvesting, you make sure you're harvesting this plant when it flowers. Sometimes the chemical types and the microbiomes that are in the soil will affect the secondary metabolites of a plant. So a plant that is grown in South Africa it may be slightly different from a plant that is grown in Mexico, and it may be the same plant. That's why we are emphasizing from farm to bedside. Because the farming method, we want to advocate for good agricultural practices that will maintain the chemical compounds of these plants, even in harvesting and processing time, before it goes to making the final product, which is our medication. What is the aim of this study? When we look at this beautiful plant on the screen, known as Digitalis purpurea, to some, it may look like a very nice, beautiful plant for the garden. This plant is highly toxic. As beautiful as it is, it's very poisonous, but very, very important in the treatment of congestive heart failure. The final product of this plant, the medication that it makes, is digoxin. So for cardiologists, this is a good plant for people who have congestive heart failure. For herbalists, they know the contents that they can use in treating congestive heart failure at their place of practice. But for any other person, consuming this plant may be very, very toxic, and it may lead to death. So Global Health Catalyst is dedicated in promoting safe, evidence-based use of plants-derived medicine in global healthcare through care, outreach, research, and education. By the end of these 8 weeks that you have designed this program for, And by the end of today, you should be able to define what phytomedicine is and its domain, understand the structure of the course and citizen science component, identify community practices worth scientific exploration. We won't be doing justice if we don't focus on the historic evolution of phytomedicine. You know, the prehistoric time just described the time where, yes, plant was used, but we don't have any knowledge about the use of plants. There's no written documentation. But from 5,000 years before Christ, then we can find some documentation from Egypt, China, India, and Greece, with Hippocrates being the father of materia medica. He documented how plants, medicinal plants, can be used. And at this time, this was the discovery of opium poppy. We all know it. It's a plant that has been used to develop morphine. Very good pain management drug. Then we come to the medieval period. The medieval period is much documented with the integration of Greek, Roman, and Indian tradition. Also, the Islamic Golden Age, where the Islamic knowledge on medicinal plants has been documented. Also, the European medicinal gardens have been documented, and manuscript preservation describing these medicinal plants. Then we come to the Renaissance, early modern period. This is where the revival of botany and medicine was experienced. We have printed herbal, disseminated plant knowledge, catalogs that are there. Early botanical classification system can be seen in this period. We have early botanical classification being experienced in this period. Then the 19th and 20th century, the modern pharmacology emergence. This is where we also see the isolation of active compounds. I've already talked about morphine, quinine, which has been a first-line treatment of malaria for quite some time, discovered in 1820 in China from a plant called Cinchona bark. Aspirin, the one we use, every dispirin, you call it, the one we use for inflammatory treatment, was discovered for willowback plant back in 1887. Then late 20th century has seen the validation, evidence validation, which now we are trying to look at the evidence, not trying, the evidence in cannabis is coming forth. We are looking at AI in drug discovery. We are looking at integrating traditional knowledge with conventional healthcare. HPLC, technological advancement. We are looking at plant genomics and how we can enhance them and how it affects our body. We are moving to personalized treatment at this age. Phytomedicine, the 20th century saw the growth of phytomedicine, and it has so many branches. When we talk about phytomedicine, we talk about applied and industrial development. We are talking about scientific foundation. We are talking about citizen science. These are just branches of phytomedicine, clinical and regulatory practices. When you talk about applied sciences and industrial development, we look how botany and biotechnology can enhance cultivation, genetic engineering, and even having new techniques of drug delivery in the body. We are looking at formulation science. Which dosage of phytomedicine should we use for efficacy and reduce toxicity? We are looking at nutraceuticals. How can we enhance supplement, especially in compromised conditions, in patients who cannot take in nutrients? We are looking at herbal drug development. We are looking at preclinical trials and patents. When we look at clinical and regulatory program, we are looking at different regulatory boards, regulatory associations. We are looking at bodies like World Health Organization, different regulatory boards, like the FDA in the US, South African Health Regulatory Authority here in South Africa. We are looking at bioprocessing industries. How do they implement good manufacturing practices in phytomedicine? We are looking at agrotechnology. How do we sustain the farming of herbal medicine? We are looking at clinical phytotherapy, the art of using phytomedicine, either singular or with other phytomedicine for synergetic effect to improve the healthcare of a patient. When we look at scientific foundation, we are looking at pharmacology and toxicology, the therapeutic effect and safety testing of this phytomedicine. We are also looking at pharmacognosy. What are the natural drug sources and what is the standardization? We are looking at ethnopharmacology, the indigenous knowledge, and how are we going to preserve this knowledge? How are we going to harness this knowledge for the better of our healthcare or the patient healthcare? We are looking at phytochemistry, the components, the active components in a plant, how can they be used and how can they be innovated so that they can be used efficaciously in a person's body? We are also looking at citizen science. Citizen science, just advocacy of plants that are found in your area. We want to do digital crowding. You're looking at the plants, medicinal plants that you're in your area. You're taking a photo of it and just sending and naming it how you call it by local names, and we tally by scientific names. We want to know where are they found in this world. We want to look at the biodiversity and the ethnobotanical data. As we are looking at this, we want to speak more about citizen science. What is citizen science? Citizen science, because it's where you and me participate. People who don't, even people who know and people who do not have any professional knowledge in scientific research concerning medicinal plants, but want to participate to source these medicinal plants from where they stay. We want to do so for biodiversity monitoring, survey the clinical usage of these plants and how we can discover drugs from them. We want to do digital crowdsourcing. You take a picture, then we could identify a plant that is found in Kenya, should be the same plant that is found in Monaco. We want to know about the policy and conservation strategies and advocate for these conservation strategies across the globe. Why are we doing this? We have seen that so many studies have shown that there are so many studies of medicinal plants that have been done globally. This is just to show a sample of the most important study, the most used study that have been used globally and the way they relate. So each color will just tend to tell you how these studies are related. Similar colors shows similar related studies. This was generated by Voss Viewer. So with these studies, we can see that there are so many human studies that have been done on phytomedicine, human and animal studies, and we can see there have been studies done in vitro study, in vivo studies, metabolomic studies, medicinal plants, antibacterial agents. So this is just to show you there's so many studies around the world. And how will we know how these studies are done if we don't consolidate this information and make something out of it? So from this, we want to develop a database, a phytomedicine database, from the knowledge of citizen science with the knowledge that has been harnessed from studies that have been done, and even clinical studies. And Global Health Catalyst want to put this together in a common database. So by the end of this, we will be very privileged if you could send us medicinal plants that are found in your area, so that it can help us populate this database. We can participate as a globe in populating this database. We'll look at different phytomedicine. We'll look at their scientific name. We'll describe their clinical relevance, how this has been integrated. We will look at the farming that went, the country that came from it. We will acknowledge even the ethnobotanical knowledge. So our face will consolidate so much information. So if you were to type a plant compound, we would want it to show like this is a plant called ginkgo biloba. It's a Chinese plant used so much for memory. It helps increase circulation. It's a vasodilator in the brain, so it helps improve circulation in the brain. And we want to look, if we were to put in a plant like ginkgo biloba in that Global Health Catalyst, it will show us the chemical compounds that are there, the efficacy, safety, dosage, application. It will even show us patient information that this medicinal plant that has been used. It will show us the ongoing active clinical trials and what studies have been there concerning these plants. What will be the relevance to global health? We just found out 80% of the global population use phytomedicine as a primary health care. We want this to be affordable, especially in the lower middle income country. We want this to have efficacious drugs that are made from phytomedicine at affordable prices, to increase the knowledge of this phytomedicine. We want to source and discover drugs for undiscovered phytomedicine. There are so many plants out there whose bioactive compounds have not been discovered. And we want to do scientific studies to exhaust and find new drugs from them. We want to see how we can integrate phytomedicine to complementary medicine, the medicine that we use in hospital. Anyway, patients still use this medicine. When they come to hospital, they don't really disclose them using this medicine. And us as medical practitioners don't know so much about these plants, so they don't ask more about it. Especially look at a plant like what is it? Oh, look at a plant like a plant that thins blood. When we have like ginkgo is a blood thinner too. So when we have such plants and a patient is using these drugs and they're coming in post-surgery, if you don't know they're using this plant, they may just overbleed when the surgery is taking place. So we must have the knowledge as medical practitioners to know which plants are blood thinners and which plants we shall advise our patients not to use before they come in for surgery, if they are facing surgery. Some plants increase the half-life or reduce half-life of some other plants, like Hypericum perforatum. It increases the lifetime of ARVs. And if we were to give a patient ARVs and they're taking Hypericum as a supplement, then it will compromise the virus in their body. So we should have this knowledge. That talks about also preventive and holistic healthcare promotion. We want to bridge the gap between traditional and conventional medicine. We want sustainable development and biodiversity conservation. Empowerment of indigenous knowledge system. We want to preserve this knowledge. We want to acknowledge where this knowledge comes from and incorporate it to modern healthcare. So by the end of this program, our course outline, this is our course outline. The coming 4 weeks, today we have been looking at the introductory program to phytomedicine. Next week, we're gonna be looking at cultivation and agricultural best practices, focusing on cannabis. We want to look at the cannabis strains and their relevance to clinical practice, the cultivation methods, the indoors and outdoors, quality control, good manufacturing practices, good agricultural practices are gonna be discussed. In this module, module 3 will focus on the chemistry, the extraction, and the preclinical research. It will look at phytochemical profiling, extraction technologies, formulation strategies, and the nano technology that is into it. So we have a very informative program coming up. We are also gonna look clinical application of medicinal cannabis. Which patients are eligible and the indications. The evidence based on the clinical application, the administrative dosage and the administrative method and dosage strategies. We are gonna look at the bedside safety risk and contraindication of cannabis. We want you to know or to ask questions about short-term and long-term safety concern, drug interaction and contraindication, and the special population that this drug can be used. We want to look at cultivation and agricultural practices, and beyond cannabis, other evidence-based medicine. We want to look at other evidence-based medicine commonly used. We're gonna also focus on application in systemic illness, like managing cancer symptoms, mental health, and sleep. And we're gonna also focus on citizen science. We're gonna showcase and then we're gonna tell you more about the certification program. When we look at the background, this is the opium poppy, a drug that is used to make morphine. It's very beautiful. It looks like a flower. To the herbal practitioner and to the surgeons, this is such an important drug for pain management, for palliative care. But to some, it's just a garden flower. So unless we dive in and learn about phytomedicine, it will just be a flower to us. But we don't want it to be a flower. We want it to be informative to you and me as practitioners and scientists and citizens. We want to know more about these drugs. What is the call of action after all is said and done? We want to integrate evidence-based care phytomedicine into clinical care, expand on interdisciplinary research and collaboration, launch public professional educative initiative, and advocate for policy reform and equity where necessary. I want to acknowledge and the director who has been working endlessly to see this program comes to life, Professor Wilfred Ngwa. I want also to give so much gratitude to Dr. Brilin, Sandra, Fleury, and Arthur, who have worked tirelessly to see that this program or initiative comes to life. My gratitude also goes to the technical team and Alpha Farms that has provided endless guidance on cannabis and its medical use. Thank you so much. I have a few questions for you before, just 3 questions. Question 1, just type in, let the answer stream in. What is the primary reason why good agricultural practices are crucial for medicinal values of plants? A, they are mainly used to increase the physical size and weight of the plants. They directly influence the type and concentration of therapeutic chemical compound the plants produce. They primarily aim to make the plant visually appealing for the market. D, they are not relevant for preventing diseases and pests, not chemical content. Please keep the answers coming. Question 2, the effective development of medicinal plant into therapeutic product from farm to bedside critically depends on the knowledge of the following, except A, traditional ethnobotanical knowledge, efficient extraction techniques and rigorous preclinical validation, botanical classification of plants, none of the above. The effective development of medicinal plants into therapeutic product from farm to bedside critically depends on the knowledge of the following, except there are the answers. And the last question, what is the most significant role of citizen science in advancing phytomedicine research? It primarily focuses on the genetic modification of medicinal plants to enhance their potency. It enables large-scale public participation in collecting botanical data, documenting traditional knowledge, monitoring plant biodiversity, and enable discovery of novel research on plant-based drugs. It is responsible for the rigorous clinical trials required to approve new plant-based drugs that you see. And then D, it serves as the main funding source for high-tech laboratory equipments used in compound isolation. Keep the answers coming. Keep the answers coming. Thank you very much, and thank you for your attention. I'm open to any questions.
Thank you very much, Dr. Tendwal, for these very good presentations. Please, everyone, I just want to send a reminder that for any question, please feel free to submit them in the Q&A. Okay. So there is a first questions, and these first questions may be directly addressed to Dr. Sandra and Dr. Berlin. The first question is there any evidence for use of medicinal cannabis and for what?
Thank you, Dr. Fleury, and thank you, Dr. Billing, for this amazing presentation. I learned a lot today about more phytomedicines, exciting. Definitely there is evidence about the use of cannabinoid therapies in the clinical practice. Mainly we have the number one that we have more evidence right now will be the refractory epilepsy in patients, particularly with Lennox-Gastaut, Dravet, and tuberous sclerosis. And there is actually a product derived from the cannabis plant, CBD or cannabidiol, purified extract. The name is Epidiolex and is FDA approved, particularly for the use of treatment in patients with the refractory epilepsy in, as I mentioned, Lennox-Gastaut, Dravet, and tuberous sclerosis, FDA approved. So this is great news because we're seeing that they're using the plant and they are creating very good evidence, randomized placebo-controlled trials. After all these trials is that the FDA approved this purified cannabidiol. We also have another pathology that is for treating patients with MS, multiple sclerosis, but particularly for treating the spasticity in these patients. And we have the product that is called Sativex. And this Sativex is also made with an extract derived from the plant of cannabis, and is a compound with cannabidiol and THC in almost similar ratios. It's like a 20.7 milligrams of THC and 2.7 milligrams of THC and 2.5 milligrams of CBD. It's in a oral pulverized form. And this Sativex was approved by EMA. That is the regulatory entity that regulates medications in Europe. And it was approved for MS, multiple sclerosis. And we have other conditions that they have good scientific evidence, like chronic pain. And among, chronic pain is a very, very big word because you can have chronic pain derived from non-oncological sources like fibromyalgia, arthritis, and also the chronic pain caused by cancer and in palliative care also. So, and in chronic pain, the highest evidence is in neuropathic pain. So patients with neuropathic pain benefit from using of cannabinoids. And also there is important research studying the use of cannabinoids in anxiety and sleep problems. So in nausea and vomiting induced by chemotherapy also there is good evidence. So depending on the levels of evidence, as you know, we have to use the hierarchy of evidence where the gold standard of the evidence is like a randomized placebo-controlled trials and the systematic reviews and meta-analysis. So these conditions that I just mentioned, they have good evidence, but there is a lot of evidence now that is being released, and there is a lot of ongoing clinical trials to keep producing more data regarding to the use of cannabinoids in the clinical practice. I just don't want to take the rest of the conference, but there is different conditions that they support, and they have important journals, publications supporting the use of cannabinoids in particular conditions. Not for everything, of course, but there is a particular and a specific conditions that they are well backed up by scientific evidence. There's other conditions that they don't have sufficient scientific evidence. As a physician, we have to be very responsible with the patients, because no, it doesn't work for everybody. It doesn't work for every condition, but we have good clinical trials supporting the use in certain conditions. So I don't know if this is clear for the person was asking, and I don't know if also Dr. Berlin wants to add something else.
Dr.
You're
Berlin, you are
muted. You're muted, Berlin.
Hello. I just want to add to what Dr. Sandra has said, and she said quite a lot. And also, just here in South Africa currently, you got what you call a Section 29 permits that are being issued to patients with different ailments, and so far they've been successful for the use of in patients with multiple sclerosis, and that has really helped a lot. So a doctor writes a motivation to the regulatory authority, to our South Africa Health Product Regulatory Authority, requesting for the use of medicinal cannabis in the flower form, in the bud form. And once that has been approved, then a patient is allowed to buy the smokable flower, which has been helping. We have been in touch with quite a number of patients. So the journey continues on. And of course, we know that it's helping and it works. But I think as we embark on this journey together, we need to just do more research and more clinical trials. So we are engaging with a number of institutions here as well to look at post-traumatic syndrome disorders, looking at psychological disorders, and also HIV, and amongst others as well. And also looking at animal health, because we must not forget the importance of animals as well as we pursue this journey as well. In terms of getting the medicinal cannabis to them as well. But so far, so good. And we are embarking on a lot of clinical studies that we just need to submit dossiers to the regulatory authority. And then from there onwards, we take it to the clinical setting. But so far, it's been working, as I said, with the Section 21s that are being given to patients with certain ailments. It is helping them, and also insomnia, that's also helping. And of course, I'm sure you've all heard about the epilepsy as well with Charlotte's Angel, the little girl who was having multiple seizures, and that's where the Charlotte's Angel strain has come from. More research is needed, but we know for sure that the seizures, the numbers of seizures she was having on a daily basis have reduced quite a lot, and she had not been given a lot of time, but she's there, and it's great news. So let's keep researching. I think that's all for now.
Thank you, Dr. Berlin, for the interventions. So we have another question, which is asking, and I think that's addressed to all of us, on whether the GSC phytomedicine database is active or not, or if it's under development. And the person is asking if it's still under development, how will the database be populated? I think that will be a Professor Will question, right? Is Prof. Will, yeah? I think we are still building a phytomedicine database to answer the questions, and especially also for the citizen science programs. We will publish more information to kind of give people more precisions on the information that will help support the building of this database. I don't know if anyone has anything to add.
Yeah, I think definitely it's very important that all of you that they are attending today, they stay tuned because we have 8 weeks of very robust education, and you will be solving a lot of doubts in the road, because we will be having different classes where we will be addressing, for example, what I just mentioned today in 3 seconds, like clinical applications and scientific evidence. But basically, you will learn about understanding medical cannabis within the US, South Africa, and different countries, the regulatory and clinical and research landscape. Also, we'll explore the best practices from cultivation to clinical applications. Also, we will be evaluating the scientific evidence supporting cannabis-based and other phytomedicine treatments. So it's very important that don't miss any of these important lectures and classes. Also, we will be assessing the safety, efficacy, and ethical considerations in the therapeutic use of cannabinoids. And also, you will gain hands-on experience through virtual simulations in extraction and clinical decision making. It's very important, as I mentioned, stay tuned, don't miss any of these important lectures, because it's a very comprehensive program that is being very well organized in order to give you a very important information about exploring the benefits of medical cannabis and phytomedicine. So thank you all for being here, and we are open to receive any questions. If you have after this, you can just write to us into the program.
Also, you'll have a chance to participate as a citizen science. You'll have a chance to take 1 or 2 medicinal plants from your area. You'll have a chance to tell us what clinical evidence that has been in it, if there's any. If there's no clinical evidence, just send it to us. We'll find clinical evidence that has been published concerning that medicinal plant, because we are towards putting a database. This is in future. We're gonna start with you as citizens providing us with information, and we shall liaise this information with the information that has been published and the clinical trials that are there to find this database that is evidence-based database. Thank you.
Also, since there are no more questions, I would like to mention that this lecture will be put weekly on the YouTube channel of the Global Health Catalyst. That's to answer the different questions on that. We are working on providing translations of the videos as well in French, Portuguese, and Spanish to kind of better address the broader community that we have. So please bear with us. We should be able to upload it in the coming days. So
Thank you so much.
Yeah, you can go, Dr. Tandwa.
Thank you so much. We just want to inform you we'll be meeting next week to unpack more information about phytomedicine, and we shall zoom into medicinal cannabis. So join us at the same time. Do not miss. It's gonna be a disadvantage to you if you miss, because this information will be up close and candid. So it will be so good for you to join and learn more as practitioners, as citizen scientists. Next Saturday, same time, same place. Thank you.
Thank you. That's wonderful. Thank you. Have a great week.
Thank you. Bye-bye.
Bye, thank you.
Bye, have a good
weekend.
week.
Bye, everyone.